Well, my friends, this is another video I want to demonstrate you. The child, age about 8 years. 8 years or 80? 8, not 0. The child, age about 8 years, is brought to me from Bhubaneswar of Odisha, is suffering from myopathy, but not serious variety, a rare variety which is known as autophagic myopathy. Now, what is myopathy and what is the cause of the disease? I have elaborated, discussed, I have narrated in many of my videos. This is a disease of muscles, wasting of the muscles, decompressing of the muscles, weakness of the muscles, reversions of the muscle protein. The muscles become weak, polymyositis, which is known as polymyositis. But the cause is different. Different causes are there. Some allopathic medicines, drugs, may also produce myopathy. If you go through the cause of the myopathy, you will see that myopathies can also be caused by various medical diseases and even by certain drugs, such as those that are used to control the elevated blood cholesterol or in other purposes. The child had an attack of rupture appendix. Immediately, rashly, it was replaced, treated, operated. After that, the weakness of the leg muscles is developed. So the question arises here, whether there is any bad effects of medicines used at that time is the cause of appearance of this muscular dystrophy is a questionable. However, the parents consult in different hospitals in India, throughout the India, Bangalore, NIMHANS. This is NIMHANS, National Institute of Mental Health and Neurosciences, Manipal Institute, etc. They are frustrated. They have learned that there is no permanent treatment in allopathy. The stage of the child is not decreasing, but the parents are worried to know the course and prognosis of the disease. That's why they have come to me to consult and for proper treatment in homeopathy, if any. Now, homeopathy treats the disease, treats the patient, not the disease. This is the main criteria in homeopathy. I have assured, I have a tendency, I have a desire, I have a habit to demonstrate the case to the parents, to the parties, to the patients, clearly with the conception of anatomy, physiology, pathology, etc. So I have demonstrated this case. What is the problem? What's the problem? Which muscles of their child's leg is attached? I have demonstrated very nicely. The tibialis anterior muscle in this subject of their child is very weak. And I have shown by the picture of tibialis anterior muscle to them. It should be massaged properly, with carefully. Now, tibialis anterior muscle, I have already shown you know, the muscles of the leg are divided into three compartments. the posterior compartment, the anterior compartment, the lateral compartment, and the anterior compartment. It is the muscles of the anterior compartment, tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus. So this muscle is weak, and due to weakness of the tibialis anterior, the movement, the walking of the child is to some extent disturbed. Please walk for a few minutes. I am showing my friends. Go there and come back. Please come back. So due to weakness of the tibialis anterior muscle, there is some disturbance of the walking. The report from the all centers, it has been clearly said it is a case of autophagic myopathy. Autophagic myopathy. So they are the papers, bundles of papers. They have consulted in different places of India. And there are a large number of files. This is Manipal hospitals. Manipal. This is Medical Super Specialty Hospital of Kolkata. So they have tried a lot. Now in homeopathy, as you treat the patient, not the disease, I have collected the symptomatology of the child. There is profuse perspiration, especially at the back of the head. The physical makeup of the child is fair, fatty, and flabby. There is a tendency to catch a cold very easily. There is salivation during sleeping. Saliva runs per mouth. And constipated, chilliness, all symptoms go in favor of Calcarea carbonica. So I like to prescribe Calcarea carbonica in 50 millisiemens scale of potencies, 0 by 1, 2, 3, 4, right from the lowest potencies. And I do believe the child will be improved by my hand with the help of dynamic homeopathic medicines. It has clearly demonstrated to the parents about the disease and its prognosis and the favorable effects of homeopathic medicines. Have you understood, mister?
Yes.
So where did you go, where you went, and what experience you have gathered?
Actually, we went to Nimans. There we came to know that it is neurologically center. So we went there. We have shown our son there. We have done muscles biopsy. We have also met the doctors. And initially, they told that it is a disease which will grow further. And so we were very worried as parents. Then we also went to some other hospitals. Manipal also we went. We have done biopsies. We have done MRIs. So in biopsy also there was no exact result came. So at the end of the day, then we are here, sir, and for the treatment, and we are hoping that our son will get better and better in future.
Thank you very much. I shall try my level best, and I do believe your child will be completely cured. Thank you, madam. Thank you, all of you. You have given permission to demonstrate this video to the homeopathic physicians. Thank you very much.